Welcome to my channel. This is Kanak, and in today's video, I'm going to walk you through a mock case interview. For best results, please pause and try to answer the questions of the interviewer before proceeding further. This is a market entry case interview from healthcare industry. Let's begin. Hello, Mark. So today we are going to try to discuss and solve a problem for one of our client, who is a large pharmaceutical company. Our client has recently developed a drug for treating hepatitis C positive patients. What are your thoughts about launching this new drug? Should they do that? And when do you think they should do that? I would briefly summarize the problem to make sure that I understand the problem correctly. So our client is a large pharmaceutical company and they have launched a drug to treat hepatitis C positive patient. And my objective is to answer if they should launch the drug and when. Am I correct? Yes, that's correct. So to launch a new drug, firstly, I would like to understand what is the total market size and what percentage of that market size will our client be able to capture. Also, I would like to understand what is the competitive landscape? Are there any existing treatment available for hepatitis C? And what are they costing to the customers? Finally, I would like to understand the profitability of launching the product, the cost to produce and the market the drug, and would our client eventually make profit through the launch? For this, I will need more data on all three aspects. Sure, I can provide some more information and data around the problem. So there are currently two FDA-approved hepatitis C drugs and five in clinical trials. Our client's drug is in phase 3 clinical trials. All hepatitis C drugs approved and in trials are delivered intravenously and would need to be administered on the regular basis for the rest of the patient's life. The hepatitis C virus is transmitted through blood. Patients who are hepatitis C positive can remain asymptomatic for 30 years. Here are some data you might find useful. So the current US population is about 320 million. Hepatitis C infection rate is 1%. The diagnosis rate is 10%. The treatment rate is 25%. Next, I'm sharing competitive landscape data with you. So based on all this information, what is the current market size of hepatitis C treatment? So the market size will be a factor of total population, percentage of people who are infected in this population. Thereupon, it will also depend upon what percentage of the infected population get diagnosed with the disease, and finally, how many of these diagnosed patients choose to seek the treatment. Finally, the dollar value of the market size would depend on the price of the current available treatment. So market size will be equal to the population times the percentage infected times the diagnosis times the percentage treated times the price per unit of the drug. If I plug in the numbers, I get the total market size to be about $2.8 billion. That's correct. Well, we observe that the percentage of patients who seek treatment for hepatitis C is rather very low, only 25%. Why do you think it is so low? Hmm. One of the very visible reasons for the low treatment rate of hepatitis C could be the high cost of the treatment. Average price per unit is about $35,000, which is pretty high for a common man. Second major reason could be that the disease is asymptomatic for 30 years. Probably patients in the later stage of their life might choose to live with the disease rather than reducing their quality of life by taking intravenous drugs at regular intervals. Or possibly the patients are just unaware of the severity of the disease and hence they choose not to get treated. Yeah, those definitely are some of the major reasons for low rate of treatment. So recently government has launched awareness campaigns for hepatitis C, and as per the experts, this would result in increasing the number of patients opting for the treatment by about 8%. Assuming that the growth in the number of patients opting for the treatment would remain constant thereafter, how long would it take for the number of patients opting the treatment to double? Assuming 8% compounded annual growth rate and applying the rule of 72, that is 72 by 8 is equal to 9, I think it should take about 9 years approximately for the number of patients to double. Yeah, that's accurate. Now, some insurance companies have also decided to include full coverage for hepatitis C treatment in their plans. Given the high cost of these drugs, why would this be financially beneficial for these insurance companies? That's an interesting question. Well, from what I can observe in the data, the infection rate, the diagnosis rate, and the treatment rate of hepatitis C is very low. So although the cost of treatment is very high, but number of patients seeking the treatment would be very low. Whereas including hepatitis C in the insurance plan would attract more customers and give the insurance companies an ability to charge a higher premium. Thus, I believe it would be a profitable venture for them. Yeah, I think that's the fair answer. If our client were to launch their drug, what would be a reasonable timeline? Assume that it would take about another 3 years for the drug to obtain an FDA approval. So I think given the high growth rate of the market and the strong competition that exists right now, it would be more advisable for the client to wait for another 2 to 3 years after FDA approval to let the market grow and then launch the product. Thus, the client would be able to get enter a bigger market. Perfect. Could you please summarize your recommendation for our client? I recommend that our client launches their hepatitis C drugs on the market 1 to 2 years after obtaining FDA approval. The current market is about $2.8 billion, which is a reasonable size. However, our client faces significant competition from three other drugs that either have or is about to have FDA approval. Due to new campaigns to raise awareness, the market is projected to grow rapidly and expected to double in less than 10 years. Therefore, launching the drug at a later time may benefit our client. In the meantime, our client should focus on passing the clinical trials and monitor the market trends closely before deciding on a specific launch date. In addition to that, I observe that the efficacy of our client's drug is 90%, which is highest among the existing players. With the right marketing strategy and pricing, our client can grab a bigger share of the higher efficacy market and also the newly created market. That's a great point, Mark. You definitely helped our client to get an answer to their problem. Thank you, sir. I hope you found this video helpful. If you want me to make more such videos for you, please like and subscribe my channel. Thank you.